where the parts are, and then you want to recognize it, because sometimes you can see in color, you can see more things, but normally in grayscales you can see more parts in gray. What you see here is the mouth. There's the chin from the child. There's his nose. You see one eye over there. The other eye is a little bit hidden. It's over there. So this is a part of the forehead. And what's in front of the face is a part of the uterus. So this part, there's no amniotic fluid between the head and the uterus wall. And if you look very clearly, you see the shoulder, upper arm, and the elbow is outside this area. Then it goes back. This is the lower arm, and there you can see the middle bones from the hand. You can see some small fingers. I recognize it? Yeah. Okay. Well, it depends on what the child is going to do, how nicely you can see it. What you see now is the live 3D, or the 4D, just I would like to call it. You see one eye over there, the mouth is there. It depends on what the child is going to do, because one forearm or lower arm with the hand is in front of the face. That's having one arm like that. What you're seeing now is I'm not moving the ultrasound head, I'm just keeping it in the same position, so what you can see is actually going into the uterus, which you're seeing now. If we replay that part for part, you can see the hand moving away from the face. A little bit backwards. But here you can see both eyes. See one over there, one over there. You can see the upper lip. It's a nice line, so it means that it should be closed. So there's no reason to worry about an open lip. And you see the lower lip over there, and there you see the chin. I print them in black and white because you can see more. I first have to look a little bit what he or she is doing now, because I first want to see really actually that it's she. She's having her face up. You can see very nicely her face in the picture now. See it? You can see the lips there, there's a nose, there's the arm coming through. As soon as she puts her arm in front of her face, the computer has some difficulty in measuring the surface from the face. So that's why it's very important that the surface before the face is clear of hand and feet and things like that. Because there's still one arm in front of the face, and you can see a small shadow in front of it. You see some small nodes over there that are parts of the umbilical cord. Sometimes I make some pictures from it. But of course the DVD, if you replay it in a computer, you can take pictures out of it as much as you can. But what you see now is just that the child is just moving around. And for this period, so 21 weeks, it's a really nice face of what you see. Because most of the children have a very thin skin, and there's very low fat below the skin. And so, sometimes when a child is lying too close to the ultrasound head, you shine through the skin.